All right, Connor, just give me a holler when we're ready.
You're all set. You can take it away.
Okay, thank you. So I'm going to read the disclaimer, which allows us to have this meeting via Zoom. So pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the open meeting law, Mass General Law, Chapter 30A, Section 18, and the Governor's March 23rd, 2020 emergency order imposing strict limitations on the number of people that may gather in one place, the Board of Health will be conducting this meeting via remote participation by the board. The meeting will be live streamed by Westwood Media Center, and the public can view the meeting by accessing the following link on YouTube or accessing a link on YouTube. Our government channels will be broadcasting the meeting on Comcast Channel 12 and Verizon Channel 42. The public is encouraged to watch our meeting via Westwood Media Center's live stream. The public will be allowed to make comments if they wish to do so during a portion of the meeting designated for public comment by raising their hand and being recognized by the moderator. The chair will continue to give guidance and instruction as needed. Every effort will be made to ensure that the public can adequately access the proceedings via technological means. In the event we are unable to do so, despite our best effort, we will post on the town website, www.townhall.westwood.ma.us, an audio or video recording or transcript as soon as practicable after the meeting.
Very good, thank you.
Welcome.
So welcome everyone. Everyone looks fine. All surviving, I take it. I guess the next order of business is the fact we already having this meeting recorded. So I guess there's no suggestion we have anyone else in the press present. And therefore it brings us to the minutes. Having reviewed them myself, I find them fine. Does anyone have any comment to make about the minutes?
No, they look good to me.
All right.
Fine to me.
Do I hear a motion about accepting the minutes?
I make a motion to
I
accept.
move. I second it.
All right, so Shelley moved to accept the minutes. Carol seconded, and all of those in favor say aye.
Aye.
Roger
Aye.
Christian,
Aye.
okay,
Aye, Carol. Yep.
Aye, Margaret.
thank you. I take it then that the minutes are accepted. Moving on.
Sorry, Shelley needs to affirm,
Oh, I'm sorry. Yes,
and you need to state your name for the roll call. You need
Shelley
to
Reaver.
Yeah, thank you.
All right, Margaret, do you have a report for us?
Okay, so in the month of December, we have had 2 non-contagious infectious disease cases that don't involve COVID. One was a Lyme disease case, and the other was a tuberculosis case. That one I am tracking. Again, non-infectious, no public health risk or concern to either one of these. Tuberculosis, of course, can occasionally have a contagious component. This particular type in this patient or resident does not. And our Lyme case, while an infectious disease to the person, is a tick specific and of no public health risk to the other community at large. So neither of these cases pose any additional public health risk to the greater community.
I take it the person with the TB is on treatment?
That's correct. And so I am, while this person was hospitalized, this person was treated beyond the infectious period for extra pulmonary tuberculosis, so not within the lungs. And we continue to monitor both with direct observation. A large part of it is done because of COVID via WebEx video, so much like Zoom, but a different format called WebEx, and the occasional house visit. So yes.
Very good.
Plugged in with the Department of Public Health, appropriate follow-up, following everything that this person needs to do. Very compliant.
Can you share what the extrapulmonary aspect is?
Meaning not in the lungs and therefore not subject to respiratory,
Okay, so
ex-
not,
yes,
no
so
respiratory at all.
no risk at all, right,
Oh. Hmm. Okay, thank you.
sure.
I guess that brings us to your report, Jared.
Okay, thank you. So there have been some revisions in a lot of the guidances that were issued through, the different executive orders. So, I'll touch on a few of those now. But first, let's talk about COVID cases from the last week that was reported. So, 345 total cases in terms of the last weekly report issued by DPH. That's up about 43 from the previous week, which had us at 302. Our 14-day average per 100,000 residents is slightly up to 32.08. And our test positivity rate had risen from 3.98 up from 3.14. So it increased almost a full point from the week prior, which has us staring down the 5% positivity threshold, which coupled with our high case per 100,000 would have us turning into a higher risk category red designation, which we did not achieve as of the last report. So there was a pretty fairly large uptick. The governor noted last week, I think 158 towns and cities joined that category of red. So it's definitely trending that way. We have been able to avoid having a 5% or higher test positivity rate so far, but more testing, more positive cases, we may get there. Since the state the governor did authorize the rollback to phase 3, step 1, there won't really be any additional burdens or changes placed upon us should we cross over into the red. There have been some metrics which we had discussed with the school committee, which we're in the process of sort of revisiting with those higher numbers in terms of interventions in the individual schools. But that's a conversation we're trying to put a plan in place to deal with on another level, maybe putting a sort of a committee together to address what the boots on the ground in the individual schools are seeing. But that, I guess, will come later in my comments. So we'll jump past that for now. So we're at phase 3, step 1. The biggest issue there, there's some limitations on crowd sizes from 50% down to 40. There's some additional guidance, which is going to lower the gatherings from public and private places. Public places, indoor gatherings have been reduced to 25. Outdoor public gatherings have been reduced to 50. And we were at 100 before. So that was significant. Obviously, all of our events must end by 9:30, with the exception of political or religious events. Quarantine guidances have been revised. Finally, we have aligned Massachusetts DPH guideline with CDC. So there's a 8-day, an 11-day, or a 14-day option for release from quarantine. The 8-day and the 11-day both involve testing and no symptoms. The 14-day guidance is the full option for anyone who doesn't get tested for COVID. They have to stay in the full 14 days. But if you want to test out on or about the 5th day, you can, without symptoms, if you're negative, you can be released from quarantine on the 8th day, and then you just self-monitor for yourself for symptoms through the 14-day period. If you develop symptoms after that 8th day, then you're required to self-isolate yourself, yourself again. contact your medical provider, your physician to reevaluate your symptoms, and you may require another test. Obviously the full incubation period for COVID is 14 days. There is a requirement for self-monitoring for anyone who chooses to try to test out of their quarantine. So long as they don't develop symptoms, they're free to go about their normal business unless symptoms develop. So that will offer some relief for people that are sort of pushed into quarantine that may be not infected but have an option now to try to test out. So those are the big ones. Let me go back to my notes. There. Yeah. All right. So those are the major changes: the phase 3 and then the quarantine. The last thing is obviously, and most importantly, the vaccine. The Pfizer vaccine has been approved and is actually in the Commonwealth and is being used. There's a small number, I think 60,000 doses or so in the first rollout, and more to come. I did hear a smattering of news today that the Moderna vaccine has also made it through FDA. And once Massachusetts approves that for use, that'll be a secondary source of vaccine. Obviously, we put in our weekly comments that, as of right now, there's 3 phases of prioritization put out by the Commonwealth for those who are able to receive the vaccine. They haven't yet given us a time frame other than to say, January, February, March, so we're more to come on that. So right now, the good news is it's starting. The bad news is it's probably not moving fast enough. But we're optimistic if the Moderna vaccine is also available, we'll have a pretty significant amount of people who want to get vaccinated heading into the spring. So that's great news. Certainly a light at the end of the tunnel in some regard. But we always want to caution people that there's a long way to go, and this is not planting a flag of victory against this virus by any stretch. It's a huge accomplishment by everyone who worked on this. But now comes the fact of distributing it and administering it to the individual, which is a gargantuan task in and of itself. So that's, I think that's kind of where we are. I don't know if you have individual questions about any of the guidances or anything to do with the vaccination plan. We're working through that now with our partners, and special thanks to Lorraine and Margaret for getting our application to become a vaccine provider. Should we be required to do so, we will be able to purchase vaccine from the Commonwealth. It was a fairly significant amount of paperwork that had to be filled out and crossed off and attested to, and they tore through that and got it approved in a very short amount of time. So I'm grateful for their efforts. But the state has not said if we will be vaccinating individual residents or it will be left to others to do so, but we are prepared to do so if we need to be. Initial indication was we would provide support, logistics, advertising, promotion, and other sort of relief efforts related to vaccination, but that's all subject to change as we start the process. They may see that there's a need for us to do it as well locally. So we're prepared. We'll be prepared for whatever we're asked to do.
Question?
Yeah.
In terms of the test positivity rate, is that related to the number of tests given or to the number of people tested?
Our rate is based on the number of tests administered. So we haven't teased out
Okay.
in terms of individuals that obtain multiple tests. Our number, we don't have facilities in town that are generating a high number of repeat test subjects. So I don't think our number is artificially inflated.
All right.
So I would say it's more accurate than the latter.
Okay, thank you.
Yep. Okay. So yeah, I got a couple of things on the school system. So we've been working with the Westwood Public Schools throughout, to assist their COVID team in contact tracing and looking for any evidence of in-school transmission or spread. Now that we have winter youth sports starting and the daily decrease of temperature in daylight, there are additional concerns of sort of more time in confined spaces. We have not seen any direct evidence of in-school transmission to this point, which is great news. They are still basing their lesson plans on 6 feet of social distancing, which was the original guidance. So we're communicating with the school side if they have questions or are moving in any individual direction. Obviously, we're there to support that effort. We are participating in a advisory group with some medical professionals, and trying to support them in their efforts to keep the kids in school. I know there's a push and a pull within the community. Some people are asking for increased opportunities for in-person learning, and some people, are looking at things the way they are and saying, well, we're okay with what we have. So it's a push and pull. I think it's a community conversation. At the end of the day, the school committee is in charge of what the school attendance looks like. We've had multiple conversations with all the stakeholders within the town government, and we, obviously we're there to support with all of our resources, whatever it is they need, whenever they need it. And we're optimistic that when the vaccine comes more widely available and we get into a time where there's warmer weather, there may be an expansion of in-school, in-person learning for students that want to be in more. But right now, where we are in terms of the virus moving so quickly through the Commonwealth, with our case counts rising, we're in the 30s per week now, new cases. We hit over 100 in November. We had only probably close to 100 in March and April. So you think about where we were as a community then, with the number of cases that were coming in. I think we had 69 in April, and that was sort of in between the shutdown, prior to the shutdown, and then the weeks following. It's to think that we're surpassing where we were then now is a lot to kind of accomplish in terms of contact tracing and cluster identification and reduction, and our hands are full. Where Margaret is working incredibly hard. I'm trying to support her where I can. We have Jason available to help with tracing. We have our part-time, postgraduate student, Emma, who's available as well. We're looking to add some additional support now that they've approved another $10 million in aid to local public health. We're going to hopefully add another individual for contact tracing assistance so that we can handle as much as we're able to handle internally. The DPH Contact Tracing Collaborative is handling about 3,500 cases, I think, on average per day. So there will be a time, I fear, when cases will linger. And obviously, the longer it takes to reach out to close contacts of positive cases, the more opportunity there is for transmission, especially in the household. So we're hoping to be a little bit faster by having more people available to make the phone calls and track down cases and their contacts to notify them of their needs for quarantine. So I think that's basically everything I wanted to say. I don't know if there's questions in the queue, or anyone else from the panel has any questions about what we've been up to.
How is the
Brad,
contact?
how many,
Go ahead, Carl.
Go ahead.
oh, no, my question was, out of the number this week, how many were students? Do you have an idea? Children?
I haven't torn through the numbers for this week. I did last week's. I'd have to pull up that file. I want to say it was maybe 8 or 9. Margaret might have a better idea.
That sounds about right. I also didn't break down the number, but I think that's pretty close to it.
Yeah.
I can get you a specific number, but yeah.
Yeah, I have it
Just
in. I have it in one of the
curious.
documents that I created. There's the reporting is never quite aligned. It's one of these issues that we have with cases that get mislabeled or pulled, or the cases get removed sometimes from the database. Either they were duplicates or they were incorrect addresses. So once we get a number, sometimes you look back a couple days later and it changes. So it's hard to know for sure how firm a number is when you get it.
Yeah, I was just curious with the percentage, yeah.
Yeah, I mean, our bigger concern is in-house transmission. I think this week I counted 6 cases were, inside of the similar household. I think that, so we had one household, with a case that was, a household member. We had another household with multiple, and then we had another household with multiple. So the hardest part we're dealing with now is how we can educate our COVID positive cases who may not have yet infected their household mates, that they can take steps inside the household, such as social distancing, wearing masks, isolating, in order to keep their family members safe while they are COVID positive. It's definitely difficult in some circumstances to provide enough spacing or distancing for individuals to keep everyone else in the household safe. And then that requires access to testing and a quick turnaround. So it's definitely a challenge. So we're starting, that's been our concern for the last probably 3 or 4 weeks, is trying to really limit that in-house transmission as best we can.
Thank you.
Okay.
In terms of the contact tracing, I remember early on, Tiffany was having problems getting information from people. Are things going better now, Margaret?
That is still true, and it is variable from case to case. There are some people who are very free with the information exchange, and I think we were just talking about it yesterday. I think it almost is related to news cycles. There's been a couple of news informational things out recently with Facebook and other places, and privacy concerns with social media in general. And so I think people, when any kind of privacy issue gets mentioned in the news, people seem to be more reluctant to share information. And that seemed to be true last week while there was this Facebook news cycle happening, but not so much the weeks prior. The past couple of days, it seems to, be better again because it's not in the news cycle. But there's people do have fear about getting in trouble, feeling guilty that they perhaps did something wrong. And so, a large part of the time consumed with contact tracing is not just letting people know, it's the educational component that goes along with it. As Jared was, in part talking about, it was, keeping people safe and letting them know what they can do. It's really easy to call and give a result. It's a much more lengthy process to do the real public health nitty gritty, where you're trying to provide some information and stop the spread. That's a little bit harder, a little more time consuming, but so it's variable case to case. Definitely still getting some people who don't want to share information. Try to reach back out to those people in the hopes that in a couple of days, maybe, when the initial impact wears off, they might be more, amenable to giving additional information. It's not always the case, but we can at least try.
Okay, thank you.
Sure.
All right. Connor, do we have anyone on the line that has a question?
I do
can
not
type
see
in.
anybody from the public in the Zoom call right now. No.
Okay. We'll give people a couple minutes if they're in or out.
So I have the opportunity to get the vaccine on Thursday.
You do?
So
Oh,
I do.
Wow.
all right. All right.
Yeah.
Patient.
That's amazing. Congratulations.
I
Let us
know.
know.
Thank you.
I'm excited
I
for
will.
you.
Let us know how it is.
Yeah, you'll
Great
have to
opportunity.
get back.
Good.
Yeah.
Good,
All
good.
right. I
Yeah,
have totals,
Thought I
Carol.
should take it.
I have totals through through the 28th of November, so we're a little bit late on the last 2 weeks. 2, 3, 4, 5. 1, 2, 3, 4, 5. And we're averaging 5 to 6. It looks like through December 5th of school age
Yeah.
cases. There's a bunch that are in that 18 to 19-year-old spot where we're not 100% sure if they're which side of senior year they're on. That's been a pretty hefty amount, but it's about an average of 5 or 6 as of right now. We're going to be
Okay.
following into this, the winter sports season's kicking off. So we'll be monitoring that too, because that's an activity that is going to be ongoing that we haven't quite seen that in practice yet. The hockey was sort of the only one that was indoors, even though an ice rink is a different sort of area than a basketball court or a swimming pool. So we'll see. But
My younger son wonders if the hockey transmission may come from the locker room, where there's considerable time as the people change from street clothes into their hockey gear.
well, they did take that away from the opportunity for
Wow.
locker room. So the second, the hockey was suspended for reevaluation and a sort of a timeout period, and that was one of the requirements they put into the guideline when it was reintroduced was you show up dressed, ready to go instead of hanging around. I think anecdotally, people on different calls that I've been on have said that I think even the governor has said something to the effect of, the transmissions are not occurring at the games; they're occurring, in the car ride over, in the parking lot, at so and so's house afterwards. So it's very hard to determine. A lot of these groups of players are friends too, inside and outside of school. So when there is a positive case, it becomes very challenging to try to unwind when and where that happened. So we'll see. Again, we're gonna be watching very carefully. But
Jared, I just wanted to say that I think your weekly emails are really good, very informative.
oh,
I hope people are clicking on the link because there's such good
thank
advice
you.
there. And I think, and you mentioned it too, masking within a household. And I don't think the state does a good enough job of emphasizing. People think of their being in their pod, but yet, since we're not in lockdown, everybody in the pod is going out and doing things, whether it's the grocery store or going to work for a little bit. So
Mhm.
I think they're really informative. So thank you for doing that.
Oh, you're welcome. I'm glad it's being read. I do get a few comments via email, some positive, some not so. I try to figure out ways to communicate, on a larger scale, what we're seeing. I think my interaction with residents is mostly on the phone. Like I talk to a lot of people. It's very much people pick up the phone and they're like, I have a question. I'm like, okay, what's your question? So this email is a chance to sort of, give a more of a linear, the case counting and things like that. I guess people have an appetite for that information. the entire time we've been providing that information, I keep thinking to myself, when we're not testing, anywhere near probably across, the state where we should be. So, the numbers are only really useful to compare how one community is versus another if you never leave that community. But, everyone, goes in and out of town to, to Dedham or to Boston or to Natick or to Framingham, to shop and visit and all restaurants and culture like there. So there isn't as much, it's usually, a bigger geography, more like a general picture of, a multiple town sort of picture, I think is necessary, to kind of give yourself a sense of like where you're taking a risk going to X or Y, versus staying in your town. So at the beginning, people say, well, I'm not going to go there if it's red. Well, then eventually everybody was red. So, but we'll keep trying to put the information out there. I appreciate that it's being read. And I know people are looking forward to seeing, how the numbers are stacking up. Hopefully, very soon we'll be able to start reporting some lower numbers, but I think we're still a few weeks away from that, unfortunately.
I think it's reassuring to know, even if the numbers aren't good, I feel a sense of anxiety over not knowing. So, people who work in hospitals get lots of frequent updates, but people who don't, my workplace doesn't send out a weekly update. So I think it's just good to give people a sense of what's going on in the state and in Westwood. So I find it very helpful. I hope a lot of people are reading it.
Okay, that's good.
Yeah.
Great.
Well, I guess you have no questions that have come into you.
Nope, I have not seen anybody come in, and no questions have been submitted.
No questions, you said?
No, no one has come in to write anything into the Q&A or joined as an attendee. And the
Okay.
Zoom info has been at the bottom of the.
All right. So is there any new business? Hearing none.
One quick thing before our new business, we have partnered with Fire. We're going to be offering 2 employee flu clinics. One is going to be at Town Hall tomorrow, and the other one will be at Carby next Monday. So we have some participants that have not been able to get their flu shots who are going to be coming in. We were able to get another 50 vaccine a couple of weeks ago. So we'll be able to offer any employees that still haven't been able to get their flu shot to get their flu shots done. And that hopefully then will take care of everybody who wants one.
Great. Well, without any new business, shall we call the meeting adjourned? Do I hear a motion?
Motion to adjourn the meeting.
Any second?
I second it.
All right, good. All those in favor of adjourning this meeting, please say aye.
Aye. Margaret.
Hi,
Shelley.
Cheryl.
And Shelley and Roger Christian. Well, thank you, everyone. Happy holidays. I guess we won't be meeting until next year.
Right.
All right.
Wow.
Good. Everyone
All right.
stay safe.
You too.
You too.
Happy holidays, everyone.
Happy holidays.
Yeah.
Happy holidays,
Holidays.
everybody. Enjoy your holidays.